The diagnosis of cancer is a life-altering event.
You know, they're unsure. They're anxious about it. They feel like their life is going to change. So I referred patients to music therapy because I could see the anxiety.
When patients are receiving radiation therapy, there is a myriad of secondary problems and issues that can come up. And this is what the program in music therapy is directed at. So the first intervention that they have when they come in for treatment is actually music therapy.
Cancer's scary stuff. And then I show up for the initial marking meeting. I got to meet Andrew and talked about the music therapy program and their goal, the stress reduction and comfort. And all of a sudden I could sense my stress level declining.
The first session is like the first time I felt some hope. I was still nervous, but I felt hope and I felt that I might do it.
What we do here at the Louis Armstrong Center and what Andrew Rossetti and his team have been able to prove through their research is that aligning with the patient right when they're diagnosed, right when they come in and they have to go through simulation, can have better outcomes throughout the radiation process.
Some of the issues that patients face during simulation, if you can imagine what it might feel like to lie on a flat, hard surface for an extended period of time, if you add to that whatever physical ailments they have going on, it's very difficult. And I think emotionally, it's a bit of a strain for them as well. It's an unnatural place, everything is new, everything is unknown.
The first day I arrived, it was the simulation. I need to have a mask on my face, and then when they prepare the mask for me, I felt confident doing that. I thought I'm strong and I have no problem doing stuff like that. But when I was there, I started to feel panic and stress. And when I left, I was a bit terrified and didn't know that's what's about to happen every day.
It's a part of what it is that they need to go through. But then when they go ahead and do a simulation and they see how the music is a part of them, especially because the music is being individualized to them, that they feel we're helping them through this, not that they're another person who's just going to have a treatment done.
I've had patients that will absolutely not get on my table without the music. And a lot of them say, you know, I feel it in the core and it takes my mind where it needs to go.
The application of music therapy in medicine is a perfect example of personalized intervention, where the intervention is tailored to the individual needs of the patient.
So the music therapy program was instituted and brought into the oncology, specifically the Radiation Oncology department, and has been an integral part of patient comfort and putting them at ease virtually from the first day that they come in for the planning of their treatment, throughout the course of treatment, and even in the follow-up clinic. So the music therapy program has taken what is something that we all turn to at all parts of our life and has given patients a level of comfort, of distraction, of familiarity, an environment where none of those otherwise exist and are unfortunately not always provided.
This is where you have to go, because they deal with you as a whole person, not just a body with a dis-ease.
I cannot really say how important it was. It was just enormously important. It was the basic thing. This is the very basic help that he received, and for which he was really, really grateful. And we all were very grateful.
Music therapy goes beyond just music, of course. Music is great in and of itself, but music therapy can specifically get at what the patient needs therapeutically through music in a very profound way. And we would be very blessed to have this as part of our program here.
We're very proud of our 20 years of research, and we're most proud of this budding Garry Dial Fund, where doctors and nurses at other hospitals of Mount Sinai, Dr. Ron Ennis and his team, are taking what we've been able to pilot here and growing it in another hospital. Through the Garry Fund, we'll be able to change the way people enter the world of cancer.
Hi, I'm Garry Dial, and I have the great honor of representing the Louis Armstrong Center for Music and Medicine for Radiation Oncology. Thank you so much.